Well, Dr. Peter Chin Hong joins us now. He's a professor of medicine and infectious diseases in San Francisco. Happy New Year, Peter. Good to speak with you again.
Happy New Year, Gerald.
Thank you. So China appears now to be the last holdout with zero-tolerance COVID policy. Even Australia and New Zealand have abandoned that. How do you think the country is faring?
I'm very, very nervous about China's maintenance of a zero COVID policy. You know, it might have been possible if it were the Delta days. It certainly would have been possible if it were the Wuhan strain days. But we're in a new era of COVID now, and with Omicron being super turbocharged and infecting probably 4 times as many people in terms of infectivity as even Delta, I'm very, very worried that it would not be possible, and a lot of people will be disappointed.
So what's a better strategy then?
Well, I think, you know, utilizing some of what China has already done very, very well, which is technology to track outbreaks. I think they've been vaccinating extremely well. I mean, using more than 1 billion vaccines and a 90% vaccination rate is something to really be, you know, very, very excited about. But I think, on the other hand, I think individualization of care, using more tools that we'll have very soon, oral COVID pills, use of testing to exit isolation earlier, and not entire lockdowns like Xi'an, a city of 13 million, which is really reminiscent of the early Wuhan days. I think at the end of the day, it's going to be very, very difficult to keep the economy going when the rest of the world has woken up from a deep slumber.
Now, as we heard, China is also announcing that it will continue to limit domestic and international flights for the coming year. How essential is curbing travel in this fight to keep the coronavirus at bay?
Well, we've learned that with travel bans with Omicron and the southern African countries, 8 of them that were banned to many countries, it really didn't do anything, and people abandoned that after a while simply because it's so transmissible. Our current and previous vaccines didn't work, and we have evidence that Sinopharm and Sinovac aren't quite as good at repelling infection as maybe some of the other vaccines. And I think the booster uptake has been relatively low in China so far. So I think all of these things make me very pessimistic that a travel ban and continued border controls will eventually work with Omicron.
Peter, you know, we seem to have learned so much, right? Because we've seen 2 significant variants take hold now, Delta, Omicron. Even though the WHO says Omicron is not mild, just severe, do you think the world has become more lax in its response?
Well, I think yes and no. I mean, I think that basically some people are worried that economy goes against personal protection and the protection of health. I think at the end of the day, we are going to continue to see these cycles of variants until we immunize everyone at the same time, or everyone suddenly gets infected at the same time, which will be very unlikely. Maybe Omicron could infect most of the world, which will lead to a lot of deaths. I mean, one thing that China did well, if you were to look at their official death toll, I mean, 4,300 deaths for the pandemic really pales in comparison to 800,000 deaths in the United States.
I mean, you speak about this need to vaccinate everyone at the same time, but vaccine equity, as we know, is a massive issue, massive problem, and despite China donating vaccines to developing countries, it's just not enough. So can the pandemic end if these countries continue to lack access to vaccines?
I think what we've been learning so far, Gerald, is that there's no one particular strategy. You can't say isolate everyone, or we can't say, you know, use only vaccines or only use testing or only use, you know, one particular strategy. It's multimodal with COVID, and we've learned to expect that if we wanted to keep as many people alive as possible. Even if you vaccinate or try to vaccinate everyone in the world, what we've been learning is that hesitancy is very real in many parts of the world. And, you know, I think at the end of the day, you probably need to use a combination of strategies rather than putting all of your eggs in one. I'm really excited, for example, about the oral pills that will come soon, Paxlovid and Molnupiravir, to the rest of the world, because it's easier to make pills and they can probably control the community viral load while we wait for the vaccines to reach more of the people of the world.